A patella tendon rupture is a tear of the tendon that connects the kneecap, patella, and the tibia. The symptoms of a patella tendon rupture include pain around the knee, a popping sensation, and difficulty walking. If imaging is taken of the knee, the patella can be seen elevated from its normal anatomical position. Treatment for complete patellar tendon ruptures is surgery. The patient is brought into the operating room and laid supine on the back. Using a blade, a midline incision is created, centered over the patella down to the tibial tuberosity. Retractors are placed and a dissection is continued down to the patella and the patella tendon. The patellar tendon is identified and prepared using surgical instruments. The inferior, bottom, pull of the patella is also prepared with surgical instruments. Stitches are placed in the tendon and holes are drilled from the inferior pole of the patella to the superior top of the patella. The sutures placed in the tendon are passed through the corresponding drill holes and tied on the superior pole of the patella. Following a patellar tendon repair, physical therapy is recommended. With therapy, patients are expected to regain full range of motion of their foot or ankle within 6 to 12 months.